my name is Maricar Cariño from BSN21, and I will be talking about the postpartum physical assessment. The purpose of this assessment is to fully assess a postpartum mother in order to prevent complications after delivery. Begin by identifying the correct patient, introduce yourself and state the purpose of the intervention. Provide for the client's privacy. This is important because it shows that we respect them and that they are secure. Set the bed to a comfortable height to work and lower the side rails on the side that you will work on. Do hand hygiene. Proceed to taking their vital signs. Start with their temperature, pulse rate, respiratory rate, blood pressure, and then check the record. Begin the assessment by assessing the breast. Begin the assessment by placing the client in a supine or sitting position. Open the gown, exposing the breast to be examined, keeping the other breast covered to provide privacy. Inspect for the following: consistency, nipple type, integrity, swelling, redness, engorgement, and tenderness. After inspecting, tie the gown. We are now moving on to the uterine assessment. To begin the assessment, expose the client's abdomen, covering the upper part and the lower extremities. Assess the tone of the uterus by palpating the area. It can be either firm or boggy. Firm uterus is a good uterus, but a boggy uterus can mean that the uterus is soft and it's prone to bleeding. Assess the height and the location of the fundus. Immediately after birth, the fundus will be at the level of the umbilicus. 1 to 2 hours after the delivery, it will be midway between the umbilicus and the symphysis pubis. 12 hours after delivery, it will be 1 centimeter or 1 finger breadth above the umbilicus. For 24 hours after delivery, it will be 1 centimeter or 1 finger breadth below the umbilicus. 48 hours after delivery, it will be 2 centimeter or 2 finger breadth above the umbilicus. 72 hours after the delivery, it will be 3 centimeter or 3 finger breadth above the umbilicus. We are now moving on to the bowel assessment. To begin the assessment, ask the client whether she moves her bowel or not, or whether flatus is positive or not. Proceed to auscultating for bowel sounds. The proper way of assessing bowel sounds is to start at the right lower, and then the right upper, going to the left upper, and last is the left lower. Moving on to the bladder assessment. Begin by asking the client for the voiding patterns, presence of pain or burning sensation during urination, palpate for bladder distension, and then track fluid balance, which is the intake and output. You can check the output by checking the catheter. The normal output is 30 ml per hour. Lochia assessment. Lochia is the vaginal discharge of a postpartum mother. Begin by assessing the amount of lochia. Take note of the time of the last perineal pad change. Note for the amount of the lochia on the perineal pad. There is scant, small, moderate, and large. Scant is 1 inch stain. Light is 1 to 4 inches stain. Moderate is 4 to 6 inches stain. And heavy is when the pad is saturated in an hour. If it's going to be rated, perineal pad, 1 gm is equals to 1 ml of blood loss. Assess the number of days the woman has delivered her baby. The type of lochia or vaginal bleeding is based on this. Lochia rubra is 1 to 3 days and the blood is red in color. Lochia serosa, 4 to 10 days and the vaginal discharges are brownish pink in color. Lochia alba, 11 to 21 days, the vaginal discharges are yellow to white in color. And then document the number and size of blood clots. Turn patient to assess for blood loss under buttocks. Remove medical gloves and then proceed to doing hand hygiene. Episiotomy or episiography assessment. Begin by wearing sterile gloves. Place the patient in a lateral position with her back facing you. Expose the client's buttocks. Inspect for any redness, edema, ecchymosis, number of stitches, consistency of discharge, and approximated edges. Palpate the edges of the stitches using either your thumb or index fingers, noting for the presence of discharges from the stitches and pain upon palpation.
Ang dali lang!
Human sign assessment. Have the patient position her leg in a 90-degree angle, either sitting down or in a supine position. Dorsiflexion of the foot will reveal pain in the cuff if positive. Other sensitivity
meron pa, hindi ko pwedeng iwanan
pain and warmth in the leg. If the patient tests positive for Homan sign, refer immediately. Any dislodging can cause detrimental effect on the patient's health and even death. Emotional status and bonding. Assess the client's emotional health, and if she is bonding with the newborn, it is important to assess their emotional health since there will be many changes going on in their body that can affect their emotional stability, and it's considered as bradycardia. After doing all the procedures, dispose or arrange used materials properly. Proceed to doing hand washing. Record all data in the client's chart. Refer any abnormal findings to the attending physician. Thank you for watching!